Hello. Welcome to Professional Courtesy in Healthcare. My name is Karen Hickman. As an etiquette and protocol consultant, I consider professional courtesy to be an essential part of any well-run healthcare practice. The patient's perception of a practice and encounter with the physician and staff is critical. If the patient feels rushed through by a rude, uncaring staff, they're left with a bad image of the organization, even if the treatment was successful. Employing and enforcing the skills presented in this training program can make the difference between a fair practice and a great practice. This program presents 4 critical areas in courtesy required for your practice to project a professional yet caring image to your patients. With a little professional courtesy, you'll be treating your patients and treating them well. Let's begin by exploring the power of a practice unified by teamwork and a single mission statement to recognize the value of the patient. After all, that's why we're all here, to serve our patients. Every member of your team, starting at the top, is responsible for the impression that your practice leaves on your patients. If you view your environment from the patient's perspective, you gain some insight into what they see when they walk in your front door. You may also learn why some patients stay with your practice and why some leave. While professional courtesy skills may seem elementary, they are powerful. Making courtesy a priority can change the mood of your practice and let patients know that they are welcome and valued. Now we'll examine the basic skills required for anyone to project a more professional image and empower themselves to move more comfortably in the world at large. Research tells us that we are judged 85% on our social skills and 15% on our technical ability. It's easy to see how important and how powerful courtesy can be. Begin by setting unified standards for every type of patient interaction, from how you meet and greet patients to how you speak with them on the telephone. Clear, easy-to-follow guidelines will help everyone understand what is expected of them. Just remember, the perceived culture and reputation of any organization begins at the first point of contact for a customer, client, or patient. A positive patient experience is essential to creating a great practice. Communication is key to understanding those around us and is absolutely necessary for successful inter- and intrapersonal relationships. Taking the time to hear what others are saying, as well as hearing what they're not saying, can help deliver better care to any patient. Often patients just want to be heard and have their concerns or complaints validated. Knowing how to do this effectively can make the difference between a satisfied patient and a very disgruntled patient. We communicate in many ways, through the tone of our voice on the telephone, the way we look as we meet people face to face, and even through electronic modes. All of these modes of communication require guidelines and scripts to avoid offending patients and to let them know that they are important to your practice. We're communicating with others all of the time. Make it positive and make it count. What you wear and the way you wear it speaks louder than most people think. It's been shown that we tend to behave in a manner in which we're dressed. If you look like you're going to work in your yard, then maybe your performance at work is not up to the professional standard that our patients expect and demand. At a time when our work environments have gone casual, it's more important than ever to distinguish your practice and employees in a professional manner. Having specific guidelines for dress can help define what can and cannot be worn in your practice. Uniforms can build a sense of solidarity in the workplace, identify who does what, and create a more professional impression. We're our own PR agents. Dressing professionally and appropriately says you care about yourself and value the place in which you're working.